Anong question? Ang dami. Recipes, ganyan.
Hello, I am Jae De Guzman. I am an orthopedic surgeon and I specialize in spine surgery. I am currently the chairman of the Department of Orthopedics at the Philippine Rehabilitation Institute. I started my practice, of course, basically after you graduate, you pack up your stuff from the training institution and then you transfer everything that you have basically related to your practice into a clinic, right? Now, I also asked, funny enough, I also asked this question to a pulmonologist much older than I am on how to start a practice. But I realized later on that there is really there's no clear-cut rule or guide on how to start your practice because it mainly depends on how many people you know are also in the medical field. I would even venture so far as to say that how big your family or your extended family is. And then maybe, I guess, further down the road is how you treat your patients. Because we have to remember, doctors, we are not allowed to advertise. We are not allowed to put our name on billboards. We are not allowed to mention ourselves as a doctor offering services. So basically, your only route of getting patients into your clinic, at least at the time when I started, is just by word of mouth. So you really have to establish your network, meaning you have, first of all, when you start your practice, no one knows you. You are a nobody. Your name does not ring anyone's bell. So when you are in that position, your doctor friends are the ones who refer patients to you. And then these patients, if you treat them well and they are happy with how you deal with their problems, how you help them, they will refer you to relatives, to neighbors, to friends. And that's how you start your practice. Basically, it's a slow process of building your name, your reputation. And of course, that can only go so far as how much you really care for the patient. You show them how they should be treated and you show them you encourage them to pass on your name to other people na hindi sila mapapahiya when you recommend it. You have to stick by your principles. You have to be guided and anchored by what you know is right and true. So you will never offer to a patient a surgery that he does not need. Or if there is a surgery that is better for that patient, you do that instead of this one. Cost should never be discussed. Like, what I'm saying is there should be no compromise per se. Meaning, if this surgery is the right surgery and it costs way more than this surgery, but this surgery is the wrong option for the patient, you don't tell the patient that to get this surgery instead. You stick with what you know is right and true. You treat your patient well. You avoid putting yourself in that situation. But of course, the world is not perfect. It's never fair. You do your job well. You explain everything, in detail. But still, there are patients that will be unhappy. That's just the way the world is. When that time comes, you have to, of course, be defensive. You have to defend yourself. But it's easy to defend yourself if you know you did the right thing. That's the thing there. Just have to be honest. And if you're honest, you don't have to cover your tracks. Everything is transparent. But if the patient is irate, like you mentioned, one thing you have to consider is where are they coming from. You always have to look at their things from their point of view. Maybe you thought you did the right thing, but you had a misstep. But the ends don't always justify the means. Maybe you failed in your rushing of things. Maybe you had another appointment. You rushed your explanation and you forgot to mention something. That's mainly where conflict arises, is when the patient is ill-informed. So the best way to deal with that, if that happens, is to listen to the patient wholeheartedly, receive everything, be open to their discussion, look at things from their point of view, and try to negotiate those waters by just explaining well and telling them what honestly happened and what should have been done. Maybe if you had a misstep, own up to it. Admit it that I forgot to tell you this. I'm sorry. This is the way we are going to go moving forward. How do we correct this, or how do we re-navigate to get in line again? I guess being more than a decade in practice already, they would have to love what they do. You don't get into this profession for the money. Not necessarily. I mean, maybe in the beginning, in the early days of your practice, that's what you strive for. But that is not where the fulfillment comes from. You really have to have a passion and a heart for helping people. You really have to connect with them at a level where it's kind of personal, but it still remains professional. That is the only way that you can keep yourself happy and at the same time, keep your patients happy.